Hi, this is Dr. Young. What I'd like to show you today is some video on the rhinoplasty procedure and give you a little introduction to rhinoplasty. So I hope you enjoy this video. Please let me know if you have any comments in the comment section below, or the links that I provide below, or you can go to my website and email me directly. Again, I hope you enjoy this introduction into rhinoplasty, and again, thanks for visiting my channel. Specifically, we're going to introduce my theory on beauty that helps us with rhinoplasty. We'll then show you numerous before and afters while discussing important elements about the rhinoplasty procedure. Hi, this is Dr. Philip Young. We're Aesthetic Facial Body Plastic Surgery and the Beauty Docs on YouTube. If you enjoyed watching this, click the like button below. Rhinoplasty has oftentimes been called a nose job. This procedure changes the appearance of the nose to fit your desires of what you want to look like. Why does the nose make such a difference in someone's appearance? The reason is because the nose is in the central part of the face. What you're about to hear is a relatively new look into the nose, rhinoplasty, and facial beauty. I discovered an award-winning theory on beauty which helps us understand the beauty of the nose and face, and our team uses it to help you get the best results available. This theory was awarded the Sir Harold Duff Gillies Award by the American Academy of Facial Plastic and Reconstructive Surgery. I have published this paper in 3 peer-reviewed journal articles, going through some of the most rigorous review processes for publication. This theory has also been featured in magazines, plastic surgery textbooks, and I've lectured about it all over the country and abroad. If you asked 100 people to place a circle inside a box, most of them will want that circle in the exact center. Even if they say they like it skewed, deep down inside, they won't be comfortable with it. Like the circle not being in the center of the box is similar to getting into a fender bender every day or something out of order in your life. Just like the circle in the box, you have shapes in your face that should also be similarly organized. Order in your face reminds us of order in our lives, which is a very strong desire. And there you have a basic premise about facial beauty. It's really just order in your face. In the oval of your face, the objects that must be balanced are your iris, nasal tip, and lower lip. You see, out of all these central objects in the face, the nose is the easiest to move and adjust. We can change the position of your nasal tip to bring more order in your face and ultimately more beauty. Here's a before and after of a 20-something Caucasian female who always was self-conscious about her nose. Her nose had what we call a hook nose with a nasal bridge bump, overly projected, large tip, and nose in general, and her nose was too long at the bottom. As you can see, we were able to address all of these concerns for a very nice result. We do rhinoplasty with an open approach. We open the nose from this bottom incision that extends in the nostrils unseen. This approach allows us to get better visualization for better accuracy and less limitations. Ultimately, we think this helps us get better results for you. As you can see, the incision heals well and can be imperceptible. This next patient had a previous rhinoplasty from another surgeon. He said that the previous rhinoplasty looked okay for the first month or so, then it went back to almost his original shape. So he wanted us to fix it. He also had a hook nose that was under-rotated with a droopy tip and a nasal bridge prominence. As you can see, we were able to achieve a nice result and he was very happy. He had some really nice words to say about my team and me. The next frequently asked question or concern is that people get anxious about shaping the nasal bones. Most people think that we break the bones. In actuality, we carefully and gently shape the bones rather than crudely break the nasal bones. Here are the fine osteotomes that we use. They are narrower than the older ones and cause less trauma to the tissues around your nose. These instruments are used to accurately cut through your nasal bones in this direction and location to help us shape your nasal bones for more refinement. We also use these fine rasps to further contour your nose and help with transitioning. Here's a before and after showing this Caucasian transgender person from Canada undergoing facial feminization with a prominent nasal bridge she disliked. We were able to accurately shape her nasal bridge down to a more refined nose. Her story of transformation was featured in nationwide General Nutrition Centers or GNC commercials. You can find the link below to watch these videos of her. We're so happy for her and we feel very lucky to have her as a patient. Many people wonder about the healing time with rhinoplasty. Here's a person's photo healing diary for you to get a visual idea of what the healing is like. First are some before and afters to see what his results are like early on. This person wanted facial feminization. Importantly, you should know that everyone is different in terms of their healing. This Caucasian male also had lip augmentation using the VY advancement technique. Again, this person wanted to have a prettier, softer look and was thinking of transitioning from male to female. The next pictures are from day 2 of his rhinoplasty. Even though we shaped his nasal bones and did an extensive open rhinoplasty, there's not too much bruising and swelling present. There is also minimal bleeding. These are pictures that he took himself because he lives too far away for us to take pictures on a regular basis during his recovery. On day 4, he looks much the same with very little swelling around the face, nose, and eyes. Most of the swelling is centered around the lips. On day 6, the swelling in his lips are going down and the little swelling in his nose has subsided even more. On day 11, 5 days after the splint was removed, he has some tip swelling, but it isn't too bad. Here we bring up an important point as well. Your nose and especially your nasal tip will look bigger with your phone and other cameras taking pictures of yourself close up. Take a picture of your nose with your phone and see how your tip looks bigger in this situation versus real life. You should be aware of this after your rhinoplasty when you might be taking selfies to document your healing too. Know that your nose is smaller compared to the pictures your phone takes. Some call this the fishbowl effect. On day 17, the swelling is coming down. You can already tell that the nose is more rotated upwards, and the nose in general is prettier and his aesthetics are markedly improved. On day 27, the person is further improved. He is even better here at 2 months after his procedure. Here 5 months later, he is showing more improvement. His nose will get further refined over the first year. In our experience, most of your swelling will go down in a week. Many people often wonder if rhinoplasty can affect your breathing. Do you have to sacrifice your breathing through your nose to look better? The answer is no. In fact, a well-functioning nose most all of the time is a good-looking nose. The nasal tip cartilages look better when they are straight on the sides as shown by the blue arrow. This allows the tip to look narrow while avoiding the pinch look. When they are straight, your airway is also much better. This pinch constricted look also applies to the nasal bones. We usually fix your septum straight because a straight nose is obviously more attractive. Because many times we need cartilage to restructure your nose to make it look better, this harvest of this non-essential portion actually helps make your airway straight and thus function better. Ultimately, you'll also be able to breathe better. Here's a before and after of a person that we did rhinoplasty to improve her looks and the functional aspects of her nose as well. She looks so much better and the portion of her nose affecting her airway was markedly improved. After improving the airway affected by your external nose, you can then see if there may be other parts like deeper sections of the nose and other segments of the airway that are impairing your breathing. This patient wanted her nose to be less wide, especially in the nostril area. Interestingly, I told her that to make her nose more balanced, we could consider widening the upper parts of her nose and to harmonize with the future smaller tip and bottom of the nose. And that's what we did. As you can see here, she looks a lot better with a smaller bottom nose and a slightly wider upper nose that ultimately created more harmony. We also carried out rear excisions that make the nostrils smaller. These excisions involve removing parts of the outer nostrils. You can also narrow the nostrils and bottom parts of the nose by removing some of the floor of the nose located here. With her short haircut and these images, you can tell in the afters that she was much more confident. I've been told that wearing short hair requires more confidence in women. Rhinoplasty can really impact your looks as a whole. This patient came in and her nose dominated her face. I knew by looking at her nose and other features that she would look great changing her nose. After her rhinoplasty, I thought she was gorgeous. To me, it was a total transformation for the better. As they say, she was really easy on the eyes. We also do a lot of complicated revisions. This person went to Korea for a rhinoplasty and she later had the implant that was placed extrude from her nasal tip. She was devastated, but by using both her ear cartilages and the muscle covering of the temporalis muscle, we were able to reconstruct her nose and get a really nice result. I wanted to do some more scar revisions on her nasal tip, but she was already totally satisfied after her initial revision rhinoplasty. She was really happy and relieved that we were able to rebuild her nose back to normal. She looked amazing. This person felt his nose was too flat. Through our morphing process where we identify your desires and aesthetic points of anxiety, he wanted to maintain some of his ethnicity. So we planned to make his tip a little softer and rounder in addition to making his tip and nose more projected and less flat. We did this by accurately and carefully adding more fullness to the area above his nasal tip. In the afters, he looked great and he felt that we achieved exactly what he wanted. Sometimes people come in and just want their old nose back. This person has a nasal fracture and a crooked nose. She just wanted her nose straight, and she didn't want to change the other aesthetics of her nose. She was really happy to have a straight nose again. Most importantly, we presented this case because the crooked nose is actually one of the most difficult rhinoplasty cases to treat. It requires many extensive techniques in rhinoplasty to achieve the straight nose and is a really big test for the rhinoplasty surgeon. Next, we want to present some people with growths and other deviations on their nose that just really makes them feel self-conscious. I had a case a while ago of a patient, not this one, but with something similar, who kept getting made fun of at work. One particular coworker always laughed at him while making comments about his big, ugly nose. He was so mad at this coworker that they would get into physical altercations. I was really happy that I could help him and improve his life. This particular person, shown here in the before and afters, was really happy with his results, as you could probably guess. We were so happy to receive this card. Here's another revision we did for a person who had a previous rhinoplasty. She had a divot on her nasal bridge, and she didn't like the butt depression, as she called it, that was present in her nasal tip area. She was so happy with her new, reconstructed, and more refined nose. Thanks for watching. We really look forward to helping you. We would love to have you subscribe to our YouTube channel. We're the Beauty Docs. We're going to be coming up with insightful videos showing you a glimpse into our lives in plastic surgery. Specifically, we're going to show you the human side of what we do. Through that, we hope to enrich your life as these experiences have enriched ours. Click the following annotations to subscribe and be the first to see these unique videos on our YouTube channel. To learn about our theory on beauty that helps us get you the best results, to see a new video showing you the relationship between holidays and heart attacks, or to see a story about plastic surgery and hope in our patient with an autoimmune disease who then developed cancer during our treatment. Again, thanks for watching, and we'll see you next time.